Type 2 diabetes is a condition that impacts the blood sugar level in which blood glucose is not correctly transferred to the cells as nutrients due to underproduced insulin or an inadequate reaction of the body to the produced insulin. Diet plays a massive role in the management of type 2 diabetes. One central question remains: how can those with diabetes eat well to help themselves? The key to properly maintaining a healthy diet is to eat foods with which your body and the medication you are on are in sync with. A diabetic diet plan serves as a meal guide for individuals with diabetes. Its primary function is to ensure that the meals consumed are favorable for diabetics' health conditions. Changing your diet might appear confusing and overwhelming. However, through research, it is seen that a change in diet can help manage diabetes and may effectively prevent long-term complications associated with the disease from occurring. Various meal plans have been formulated for the type 2 diabetes patient. No predetermined program is said to work for every diabetic patient, as each patient's body's reaction is unique to various food classes. So, many critical factors will need to be considered in a diabetic meal selection process, like age, physical activity, gender, underlying health issues, and weight. Nutritionists and health professionals help to offer diet advice to diabetic patients. One common thing about these meal plans is the reduction of carbohydrates in meals. Carbohydrate is a significant source of glucose, and so reducing carbohydrates essentially means reducing the amount of glucose in the meal, thereby significantly impacting the blood sugar levels. In some diabetic meal plans, there is a complete elimination of carbohydrates and more focus on proteins and fatty foods. However, as against popular opinion, a type 2 diabetes meal plan doesn't have to be low in carbs, high in protein, and high in fats. Instead, a focus should be on the quantity of these nutrients in the food. Some healthcare professionals and research carried out have stated that diabetic patients can be able to eat meals along with the rest of their family with keen attention to the quantity of their meals and when they eat them. As a diabetic patient, you do not always have to follow one strict diet plan. You just have to find a way to combine healthy foods in quantities that will positively affect your health. This video will share the various and most effective diet plans, measurements, and tips you can adopt for a type 2 diabetes patient. Be sure to watch this video until the end, because there will be so much exciting information shared in this video. Also, like this video, subscribe to this channel, and share this video with anyone you think will find this information helpful. Here are some diet options and guidelines that are suitable for people with type 2 diabetes. On calories. Calories in a diabetic patient's meal are based on the amount of food and the timing of each meal, and can vary depending on other related health factors. The recommendations for calories are generally between 1,200 and 1,400 calories for small women, 1,400 to 1,600 calories for small men and medium women, and then 2,000 to 24 calories for large men. The diabetic meal plan is aimed at helping individuals with the type 2 diabetes lower their cholesterol level by helping them and guiding them to eat foods that will contribute to their weight reduction. The number of carbs, proteins, and other food classes consumed depends significantly on an individual's unique health attributes. A high fiber meal can improve cholesterol levels. The following are general meal plan guidelines for type 2 diabetes patients to help reduce cholesterol levels. Reduced fat intake. Since cholesterol is primarily found in fatty foods, reducing diet's daily fat will significantly impact diet. Fat should be limited to an average of 30% of total daily calories, with up to 20% from monounsaturated fats like avocado, olive oil, sesame oil, less than 10% from polyunsaturated fats like corn oil, salmon, walnuts, sunflower seeds, and less than 6% from saturated fats like cheese, butter, cakes, biscuits. Reduced carbohydrates. As earlier stated, carbohydrate is a significant source of sugar. There is a tendency for meals to be high in carbohydrates because most major foods contain some degree of carbs. However, it is essential to reduce the level of carbohydrates you take in your meal. Carbs should be no more than 55% of your daily calories. Dietitians recommend not more than 2 to 4 servings of carbohydrates per meal. with each serving between 50 grams. Even with this level of carbohydrate exposure, it is good to avoid simple carbohydrate dishes like sugarcane, white rice, honey, and white flour. Sugar-sweetened dishes and meals like cakes, pastries, candy, and soft drinks have low nutritional value. Still, they are very likely to increase sugar in the body, and so should be eaten rarely, and if ingested, taken in small amounts, as large quantities might be harmful to the body. Incorporate fibers. Fiber dishes are easy to skip as they do not essentially form a big part of regular meals. As a type 2 diabetes patient, you should learn the habit of incorporating fiber into your dish. Fiber helps in decreasing the absorption of harmful sugars in the body. Do well to eat between 20 to 30 grams of fiber daily. Some dishes containing fibers are nuts, seeds, pears, oranges, berries, whole grain bread, and oats. Research and testing has shown that fibers improve blood sugar and also helps cholesterol levels. Also, since fibers are pretty filling, you will not get hungry quickly, and this will prevent you from eating in larger quantities than necessary. Eat proteins. Protein dishes are also very essential in managing type 2 diabetes and should be about 20% of your daily calories. Reduce cholesterol. In the end, ensure that your cholesterol level is not above 200 milligrams per day. Take vegetables. The best vegetables for a diabetic patient should include fiber, potassium, magnesium, vitamin C, and calcium. Dietitians recommend 2.5 to 3 cups of vegetables per day. The following are vegetables that are good for diabetic patients: red onions, sweet potatoes, bell peppers, squash, and broccoli. Watch your salt intake. Heart diseases and strokes are more common in people with diabetes. Salt contributes to high blood pressure that leads to strokes, and taking salt in large quantities increases the risk of developing high blood pressure. A healthy diet low in salt can help minimize this health risk. A substantial amount of salt comes in packaged food, as salt serves as a preservative. And so the best way to limit salt intake in your meal is by eating mostly fresh foods. If you are looking to buy packaged foods, ensure that you read food labels very closely to avoid purchasing food products that are high in salt. Food scientists have recommended an upper limit of salt as 2,000 milligrams per day. Avoid alcohol. The American Diabetes Association set a benchmark on alcohol for people with diabetes to follow. These guidelines are the same for people without diabetes. Women are expected to have no more than 1 drink a day, and men should have no more than 2 drinks a day. Still, always check with your doctor to see what is right for you. We have shared with you food measurements and healthy proportions of various foods for a type 2 diabetes patient. However, it is vital to accurately measure your food portions for the diet plan to be effective. A very simple way to allocate your balanced meal is to divide your meal plate into 4 parts. The first part will be proteins, the second part will contain carbohydrates, and the remaining 2 parts will include healthy fruits and vegetables. By following this plate allocation method, you can tailor each diet plan to be one that positively affects your type 2 diabetes health condition. Some general examples of meals that can be beneficial to the type 2 diabetes diet include vegetables, seeds, fruits, poultry, beans, non-fat dairy products. Your diet plan and temptations. Let's face it, not everyone will be able to withstand the temptations of not eating sweets and unhealthy foods on a daily basis. Sometimes it can be challenging to pass on an excellent sweet dish. In those times, you can practice the following tips. Stay consistent with your meal plan. The truth is that with consistency, cravings reduce. The more you follow your healthy food plan and stay consistent in your diet, the less you will crave sugary meals and dishes. This is because your body grows accustomed to your meal plans. Permit the occasional cravings. There are some times that you just crave some sort of sweet dishes. You can allow yourself to have these dishes once in a while when you are entirely sure that the effect of the meal will not be too much on your body. Ensure that you always strike a balance between your diet goals and how urgent your cravings are. Don't look to satisfy your sugar cravings every day. Bring your family on in your diet journey. The dieting road can feel lonely and boring at times, but when you are on a journey with like-minded people, it is easier to make a healthy diet a lifestyle. The diabetes diet plan is healthy enough for everyone and not just people who have diabetes. It has the ability to improve the health of average individuals who might not be struggling with diabetes. You can introduce your diabetes diet as a regular meal plan for your family, and this helps you to beat temptation and also to stay motivated with a community of people. Temptations occur in almost all significant aspects of life, and nutrition is not left behind. To effectively dominate over the temptation that arises in a diet change, you must be driven and ready to implement your dietary changes. How far have you gone with your diet plans? Which of the following diet habits above are you familiar with, and what is your greatest diet temptation? Please share with us your experience of diabetes dieting in the comments below. Be a part of our healthy Type 2 diabetes diet program created to help you reverse the Type 2 diabetes by signing up using the link below. It is definitely going to be a rewarding diet experience. Subscribe to this channel to watch similar videos and stay up to date with health-related conversations. If you love this video, do well to give us a thumbs up. Thanks for watching and have a great week.